And we are seeing surges of COVID cases in countries considered to be successful. And we'd like to discuss that more with our epidemiologist. We have Bapak Diki Budiman from Griffith University. Pak Diki, how are you?
I'm good, thank you. Hi, Raf, Fifi. Good evening.
Alhamdulillah. Pak Diki, why are we seeing a record surge in COVID cases in countries we considered very successful in overcoming the COVID-19 cases?
So much of Southeast Asia is now similarly poised. Across the region, clusters have been found in places where defense are weakest, like hospital, quarantine facilities, and border crossing. Lapses in those places allow infection to spread more widely. So moreover, the virus has mutated over the past year, and the variant spreading now are more transmissible. So that include B1617, first identified in India, which has appeared not only in Malaysia and Singapore, but also in Indonesia. So, and also Thailand and Cambodia. So the wave currently we saw in, let's say, in Singapore and Malaysia, instead driven by the more aggressive nature of the new strain B1617.
So are we talking about kind of like a race between two V's? The first V is the vaccination process, the vaccines, and also the second V is the variant of the virus. I mean, if this is the trend, then when are we going to ever see the end of this pandemic?
So, as in the region, for sure, we will have the crisis until at least end of this year. But for Indonesia itself, maybe we will have until the mid-year next year. But again, it's depend on how the new variant will evolve, because when the new variant will evolve within three criteria in epidemiology, we can say more lethargic, more lethal. It means it's easy to make people will die, and more severe and more easy to transfer, and also more easy to evade the immune system. So then we will have a disaster, very serious disaster. So it's depend how we not only one country, but as the region, as the global level, the global collaboration, we deal with this pandemic. So again, it's depend on us, all of us.
Pak Diki, I'd like to discuss about community outbreaks happening in, say, Singapore. We know Changi, yes, the international airport, has been closed for quite a while. And because the COVID cases are infecting the frontliners. So can you say that only wearing masks as a health precaution is not enough? What is your perspective on that?
No, it's not enough, of course, because again, the latest data from the UK, let's say, especially the B1617 variant, is very easy to transmit, and it's not enough to just wearing even 2 layers of mask, because then we have to also make sure the distance, and also we have to make sure the quality of the ventilation, the circulation, the air circulation, and also again for all frontline workers. Let's say you mentioned, Vivi, about this let's say the borders staff in every country, and also in airport. They have to be vaccinated. So, and the good things from vaccine, let's say AstraZeneca and Pfizer, they are effective. They has been proved effective in dealing with this new variant. So, but so far, let's say for Indonesia context, many of our frontliners already get vaccine with Sinovac, which is we don't know yet the effectivity for this new variant. So it means we have to, let's say in ASEAN region, we have to also review our vaccination program for these frontline workers.
Very well then, Pak Diki Budiman from Griffith University. Thank you for joining us. Stay safe and healthy, Pak.
You too, Fifi and Ralph.
Diki
Well,
Budiman.
Ralph, so a mask is, that's not enough during this moment, at this time. Aren't you a bit scared or afraid?
Of course, especially considering Nadia before that giving us information that we're using double masks over there in Malaysia, right? So like if single mask, double layer masks, I mean, when is enough?
Okay, so the message is don't let your guard down yet.
Yep.
Okay, COVID-19 is still ahead. I'm sorry to say that.